Hello and welcome to HDtv Health District Television, brought to you by the Southern Nevada Health District. I'm Brian Gresh. Warming temperatures mean swimming pool season, and while that should create nothing but great memories with family and friends, unfortunately it means an increased risk of drownings, particularly among our younger children. But Rosanna Silva-Minnich is here now with a new way of looking at this deadly subject.
Sadly, in Clark County, the two leading causes of accidental death in children under the age of 4 are motor vehicle accidents and drowning. We at the Health District are determined to reduce those statistics. Also, we are getting great support from one of our community partners.
At Southern Nevada Health District, we've been maintaining a pediatric drowning registry since 1994. Medic West Ambulance is well aware of our campaign here at the district to try to reduce the number of pediatric drownings that occur in our community each year. And so they approached us last year and said that they were planning to do a prevention campaign and were looking at including a prevention message that would be important in the community, and we decided that drowning was a great place to start.
Medic West wanted to do something for our community and educate at the same time, and so when we have an ambulance like behind me is our non-emergency type of ambulance that we use at special events. We use to transport somebody from the hospital to home, and it's a non-emergency setting, so it's not a 911 ambulance. And we wanted to use something to educate the community at the same time.
The vinyl-wrapped ambulance is mainly used for educational events, especially for children. And when Matt refers to it as a non-911 unit, he means you won't see it responding at high speeds with lights and sirens. Its eye-catching appearance could be difficult for drivers to identify, so it's only used for non-emergency calls.
Actually, this was done free of charge. There was no charge to the health district. This was a community service that they offered to us, and so we were delighted to partner with them.
It is quite an expensive process to do, but it is an investment for our community that we felt that was important.
The unique ambulance serves two purposes. For many of the children, it's their first look at the inside of an ambulance, and it creates awareness to this preventable cause of child deaths.
Since we began collecting the data in 1994, we've had over 700 children who have suffered a non-fatal drowning event, and we've had over 150 children fatally drown as a result of access to water without appropriate supervision. So we strongly encourage our layers of protection, our ABCs and Ds of drowning prevention, which is active adult supervision, barriers around your swimming pool, classes that include both swim lessons and CPR classes, and also appropriate devices, which means rescue tools at your poolside and also life jackets if you're in any open body of water.
Fatal child drownings are only part of the story. The non-fatal events, which used to be called near drownings, can be as devastating to the victims and their families.
Fortunately, for each child that drowns, fatally drowns, there are generally at least 4 children that are admitted to a hospital, and at least 20% of those, based on the national statistics, end up with some form of permanent disability as a result of their submersion incident. Because a child can lose consciousness in as little as 2 minutes and can suffer permanent damage in 4 to 6 minutes. So just that brief lapse in supervision can be catastrophic.
And the danger isn't limited to swimming pools or any one season of the year.
Any body of water that is enough, even an inch of water for an infant, enough to cover their nose and mouth, can result in a drowning. So certainly a child that's not appropriately supervised in a bathtub. We've had children drown in buckets of water, toilets, fish tanks, ponds in the backyard, the lake. Lots and lots of different opportunities, unfortunately, for children to gain access to water, which is why we talk about active adult supervision.
Education goes so far in preventing these tragedies. It is one of the reasons we're so pleased Medic West volunteered to help get the message out.
We have a lot of wonderful partners, and because I work in the Office of Emergency Medical Services and Trauma System, it was especially gratifying to have one of our EMS agencies step forward, recognizing what a significant problem it is in the community, and to assist us with the prevention campaign. These are very difficult calls for our EMS providers to go on. They know that just moments prior to their arrival, there was a child that was warm, pink, and happy that may be now cold, blue, and lifeless.
On all our ambulance, we have 2 words that says "we care." And Medic West cares about not only our co-workers and our patients, but we care about our community. If we can stop one child this summer from drowning and that we don't have to run on that child and that child's limp body coming out of a swimming pool, then that's what we've done, and that's the purpose of this ambulance.
If you'd like to have the Medic West ambulance free of charge for an event, please call their Community Relations Department at 650-9900. More information on drowning prevention is available on our website, snhd.info. Brian?
Thank you, Rosanna. Here's another big step forward in addressing the issue of childhood drownings. This past April, you may have noticed community events going on under the banner of April Pools Day. It marked the launch of a new coalition, the Southern Nevada Child Drowning Prevention Coalition. It's comprised of notable individuals in the community, such as Clark County Commissioner Susan Brager, Henderson City Councilwoman Jerry Schroeder, along with building officials from Clark County, North Las Vegas, and the City of Las Vegas, as well as representatives of the pool industry, fire departments, EMS providers, and of course the health district. It's a coalition of folks coming together to find effective strategies to address this problem year-round and not just in the summer.